So there are several types of health economic analysis, and then as I go through, I will try to exemplify with who are the intended audience for those type of analyses, what is the meaning or interpretation for such analyses, and what value do they drive. So to start off, the most common one that you may have already seen around is the budget impact analysis, or budget impact model, BIMs as they're typically called. And they typically try to envision a scenario 3 to 5 years ahead of time. What would be the value of this intervention? What would be the budget's savings or budget impacts of a new intervention included in our current healthcare, in our current market landscape? And this is typically the type of scenario that PBMs or payers would want to see, because they are the budget managers and they want to see the impact, the financial impact again, on their healthcare environment, their populations that they are managing. In contrast to that, there are cost effectiveness analyses which incorporate a little more than just the costs. So effectiveness piece of the cost effectiveness analysis includes, typically effectiveness includes quality adjusted life years, which would mean how much would the life of a person improve in over 1 year. And we're talking about including that life year plus any additional happiness or utility that is gained out of that. So those types of analyses are relatively more important for physicians and providers who are not just looking at budgets, but overall health of the patient. If the health of the patient improves, but the technology costs a little more, it may still be worthwhile to invest in such a technology. On the similar terms as a cost utility analysis, again, depends on the country. For example, Canada requires cost utility analysis, not cost effectiveness. So utility just simply looks at the happiness, quote unquote, happiness of a person over 1 year or over a defined time period of the model. So this can be used to compare different technologies across the healthcare sector. It can compare costs and utilities separately, but it does not differentiate between what are how does the quote unquote happiness of the person or the patient change within the duration of that defined time period. But that is another type of analysis. Another type of analysis, which is even broader, is the cost-benefit analysis, which just simply evaluates the cost and health effects of 2 or more treatments, which means that the benefit could entail clinical benefit. It could be improvement in some clinical score. The benefit could also be utility or quality, monetized into a dollar value or a pound value, as the case may be. But it's generally used when the quality benefit or the time period is so small that any reasonable comparison across utility or effectiveness is not going to be validated. That's when benefits can be used. And this is just a snapshot of the types of analyses that we see. There are several other analyses that can be conducted. Again, taking example of some of the Nordic countries, for example, or Australia or Canada, where there is non-inferiority, or in medtech case where there's comparability across devices, cost minimization approach or trade-off analysis can be used, and those are much simpler analysis to showcase value of a new technology and how it may save some costs in the overall budgets.